Hi everyone. I'm Dr. Caitlin Hall. I'm one of the physical therapists with Ware Health. Thank you for being here today. Today we're diving into the complex topic of chronic pain. While pain is something we all experience, there's still a lot of uncertainty and misconceptions about what it really is and how it works. So today my goal is to bring some clarity to this complex topic. We really have made leaps and bounds on our understanding of pain. So I'll be sharing with you some of these contemporary insights and management techniques. So today we'll touch on a bit of the basics. What is pain? The definition, difference between chronic and acute pain, the treatment options that we're seeing that has been successful, and in general, how we measure success. So I'm going to have you go ahead and take a picture of this slide because we're going to move off of it, but I want everyone to have an opportunity. So because you've joined us for this webinar, you have the opportunity to receive a $15 gift card, whether a new or previous user. So if you schedule an appointment today, it doesn't have to be today, it could be sometime next week or in the next 2 weeks, you'll receive a $15 gift card for attending that evaluation as a thank you. So you could text that phone number or send an email to the email listed with your email and with the company you work for, and we'll send you the unique scheduling link for that company.
Does this work? Okay. Okay.
Oh, let me just see if you could. Just if you could mute participants if you can. All right. Well,
oops, Caitlin, you're muted now.
I got it. So September's right around the corner, and it's also Pain Awareness Month. Pain Awareness Month is dedicated to raising awareness of the issues that people with pain face and with the help of educating and empowering people living with conditions that cause pain. So it's estimated about 10% of the world's population endure chronic pain. That's about 60 million people. So you imagine how extensive this issue is, and it definitely warrants a full month of awareness. So what is pain? Let's just get started with that. The International Association for the Study of Pain defines pain as an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. Keywords here are actual or potential. So pain is a universal human experience. It affects everyone regardless of your age, your gender, income, race, geography. Although these factors may impact one's pain experience, pain is created by the nervous system when our body detects an actual or a perceived threat. So the nervous system is our brain, our spinal cord, our nerves, but pain has influences from other body parts, other body systems. So it's not solely a nervous system process. It's not all in your head by any means. Pain is not always associated with tissue damage. Any credible evidence of danger to the body may trigger a protective pain response. We have pain in the absence of tissue damage. Think of the case of fibromyalgia or phantom limb pain. When your brain thinks, phantom limb pain is just when your brain thinks a missing body part, like an arm or leg, still hurts, even though it's not there. But when an injury has healed, but the pain continues to persist. There's not a one-to-one ratio between pain and tissue damage, especially with chronic pain. Pain is one of our body's protective responses. It's a sophisticated protective response. There are many other protective responses in our body, like our immune response, our fight and flight response, and these all often work together with our pain system to protect us. So acute and chronic pain are quite different. Acute pain occurs when pain comes on suddenly, like with an injury, an ankle sprain, maybe you wake up with a stiff neck or sore neck. It usually resolves within 3 or 6 months or when the tissue heals. Keep in mind, different injuries heal at different rates. Nerves may take longer to heal than bones or muscles. And unfortunately, acute pain can sometimes become chronic pain. Chronic pain is pain that persists longer than 3 or 6 months, or longer than what is considered normal for tissue healing. Today, I'm mostly focused on the case of chronic pain without a clear medical diagnosis or injury. But pain can persist for long periods of time due to medical conditions, think rheumatoid arthritis or cancer-related pain. But the main driver of chronic pain that we're focused on is not necessarily a medical condition, but it can be tied into that pain experience. I want to give a quick analogy of the nervous system since it sends and processes signals throughout the body. The nervous system is basically an interstate highway system made up of about 400 individual nerves that carry information about the body's current state. So those 45 miles of the nervous system are constantly taking in information from our environment as well as within our own body to provide information about how we are doing. Are we safe? You could think of our pain system, as one of our body's internal alarm systems. So an example I'm going to use is for normal pain alarm cycle is the case of stepping on the Lego barefoot. I'm sure many of you have stepped on a Lego in your life, whether you have kids, grandkids, siblings, nieces, nephews. It's not a fun experience. But when you step on a Lego, the alarm system, that pain alarm system ramps up, sending a message to the body to get your attention so you can act to protect yourself. Maybe you yell. Maybe you stop and remove that Lego that's now lodged into the bottom of your foot. You check for tissue damage. Is there bruising? Is there bleeding? Maybe you'll treat it with a Band-Aid, or maybe you'll limp to offload that painful foot. You're trying to allow it to heal. The alarm system eventually calms down after that and prepares to warn you of another Lego in the future. So now you've learned to watch your step when you enter your kids' playroom. So this pain alarm system, it has adjustable sensitivity levels, kind of like a guitar amplifier. These levels can be adjusted based on the situation or our emotions or even our past experiences with pain. For example, imagine you stepped on that Lego while running out of the house. This is a very extreme example. While running out of the house, away from a fire in the kitchen, you would likely not stop and look at your foot and pull the Lego out of your foot. You're probably just going to keep running. You may not even notice that you have pain. Your focus is getting yourself and your family out of your home. Your energy is focused on getting safe from that more imminent threat. So the sensitivity level to the Lego and the foot is much lower. In about a quarter of people, the alarm system doesn't calm down after ramping up. Instead, it stays sensitive. That extra sensitive alarm system, as opposed to tissue damage, which should be healed or should be healing or healed at this point, is the primary reason why we're still experiencing pain. Now there's less tolerance to activities. Maybe you could only walk a quarter mile compared to the mile you used to do every day because of pain. Pain continues to persist beyond the time frame that the alarm system should have calmed or for the tissue to have healed. There are several potential causes that can be associated with persisting pain. Some of the ones I'm going to discuss are failed treatments. Maybe you've tried multiple different treatments, bed rest, injection, nothing's worked. Stress and anxiety is often associated with chronic pain, both as a cause and a symptom. Having multiple inconsistent explanations of why you have pain can perpetuate the issue. Feelings of hopelessness, difficulty coping, fear of movement, lack of support, poor sleep, and past experiences with pain could all potentially cause pain to persist. So the impact of chronic pain can be significant and can be a cycle that's very difficult to break. It can vary person to person. Pain is truly a very personal experience. It's unique to each individual. You can see from this list that chronic pain can impact individuals in many, many ways. One thing I want to emphasize is that people in pain often abandon healthy behaviors or things they previously loved doing for less or no activity due to feeling that they are no longer able to do those things or it is unsafe to do those things. So they're abandoning these meaningful activities because of their pain.
Hey, Caitlin.
Yeah.
I don't know if it's just my screen, but I don't see sharing. I don't see your screen sharing. I don't know if anyone else can see it, but
I can see the impact of chronic pain slide.
Yeah.
okay. Maybe it's just my end. I'm gonna look for it. Thanks.
Okay. Okay. So X-rays and MRIs and scans in general. Oh. Okay. They don't always paint a perfect picture of or give you the reason of why you may be experiencing chronic pain. So we know pain can be present in the absence of tissue damage or after injuries healed. So in these cases, pain, especially in chronic cases, like I said, and tissue damage are rarely a one-to-one ratio. Often those who have imaging early with an injury have a predisposition to experiencing chronic pain. Imaging can depict normal body changes, but we're often told those changes may mean there's something wrong with us or that we're broken. There's a lot of evidence that shows that people are living pain-free with these changes on X-rays, MRIs, scans, including bulging disc, rotator cuff tears, osteoarthritis. So a lot of these changes can potentially be just age-related findings. Our body has incredible ways to make up for tissue injuries. We are healing machines. Full ligament tears have shown to heal on their own. Muscles in the shoulder can make up for a torn rotator cuff tear or torn rotator cuff muscle. I just think it's really important to recognize that although imaging can be relevant to certain injuries and conditions, absolutely, it doesn't always show the root cause in chronic instances because people are living pain-free with these conditions and with these changes. So basically, imaging doesn't always show the amount of pain you feel. It doesn't show your future pain levels, and it doesn't show your ability to do daily activities. Don't get me wrong, findings on scans can be very relevant to specific issues or acute instances of pain or injuries, but they don't provide the full picture in chronic pain cases. What scans do show is age-related changes, wrinkles on the inside, and potentially findings that they have already been there and that may still be there when your pain's gone. To treat chronic pain properly, we really need to understand the whole story. How one's life, their history, social, mental health and wellness play into the bigger picture. Bottom line is pain is real and it's complex to treat. So when you think of traditional treatment methods for chronic pain, what comes to mind? You don't have to say it out loud, but I'm sure it's one of any of these on this list. These treatment methods can absolutely help, but they don't always get rid of pain. They may not be getting to that, like I said, that root cause of your problem or the reason why you're having that persisting pain. Some of those reasons for persisting pain, like I said earlier, fear of movement, stress, anxiety, lack of social connection, being unsure why you have pain. Medications can help ease or mask the pain, but often the effects wear off over time, and they often have significant side effects. They're generally overprescribed and unfortunately can be I have a recording stopped notice. Just can you re-record? Oh my God.
Yep.
This meeting is being recorded.
What was it? Oh, so yeah, a lot of people get surgery, and they still have pain. We're often trying to fix something that actually isn't broken. And traditional physical therapy can be great, focused on core strength, exercise. It definitely can be helpful. Once again, may not be addressing that root cause. A lot of people leave in more pain and don't come back. So I'm going to get into a bit of detail about current, more modern treatment methods. It might not be what you think, but these strategies that are currently being utilized have really promising results. And they include education, graded exposure, and pacing, and general lifestyle modifications. So in regards to education, just understanding pain has shown to reduce fear of movement. It has shown to improve function and facilitate coping. Once people understand that pain doesn't necessarily mean there is something physically wrong or harming their bodies, they stop seeing pain as a threat. Another treatment strategy is graded exposure or pacing. So let's take the analogy of medication. You start off on a new medication, the doctor gives you a high dose, and you experience significant side effects. This is often similar to prescribing exercise activity to a patient with chronic pain. We need to start low, with low, less threatening dosages, and gradually build from there to avoid flare-ups. Finally, addressing lifestyle. And we'll talk a bit about that next. So I like to think about chronic pain as a puzzle we're trying to piece together, especially for people dealing with chronic pain. In addition to traditional treatment, or sometimes a replacement of some of those traditional treatment methods, we want to educate our patients. We want to set meaningful goals. We want to help to manage stress through different strategies like mindfulness, meditation, breathing. We want to encourage patients to avoid or reduce substances like tobacco or excessive alcohol. We want to encourage physical activity. It could be anything like yoga, a walk, gentle stretching, finding something that brings you joy, that you find is something you love doing. We want to teach strategies for restorative sleep. We want to utilize graded exposure and pacing to introduce movement and exercise. And we want to help encourage healthy nutritional habits. So treatment really, truly does vary. What we focus on most depends on the patient. As a physical therapist, we definitely want to look at your strength and your posture and your range of motion, no doubt. Those impairments can definitely play into your pain. It's also important to make sure we're addressing these other factors that can impact chronic pain, like sleep or stress, and guide you to the proper resources. So we hear all too often that patients are fearful that they'll never get better, or they've had providers tell them they won't get better. But chronic pain can get better. We are bioplastic. If you've never heard of that term, bioplasticity just refers to that remarkable ability of our bodies and brains to adapt and change in response to our behaviors and environment. Through bioplasticity, we learn pain, but we can also unlearn pain. It's important that for our patients with chronic pain, we really focus on function. So as function improves, pain will reduce. For those who've lived years and years and years with pain, we want to keep in mind, maybe we can't get rid of the pain completely, but we can help reduce the severity of it or the frequency of it, and we can at least get you functioning more and living a more meaningful and joyful life. So setting meaningful functional goals is key. Getting a full night, it could be anything from like getting a full night of sleep without waking due to pain, or attending that final end of the year camping trip with your friends and family without fear of a flare-up. So keep in mind that treatment is multifactorial. We've talked about that. It's not just about addressing what we see on x-rays or scans. Treatment involves tackling thoughts, beliefs, and encouraging behaviors that can reduce the threats perpetuating pain. So when measuring how folks respond to treatment, it's really important to recognize that progress happens in stages. Celebrating the small wins along the way is just as important, as these victories build the foundation for larger successes. So some small victories may look like completing a 5-minute breathing or stretch routine a couple days a week, or reaching your daily water goal, or researching new hobbies, sitting outside, getting some sun or fresh air, reading outdoors, and connecting with a friend or family member once a week, whether it's a phone call or through social media. And as we accumulate these small wins, they pave the way for bigger milestones in your recovery. So let's explore those big wins and how they represent significant progress on your journey to feeling better. So you've researched those new hobbies, now you're executing, you're trying those new hobbies, crafting, painting, piano, anything. Finding outlets that spark joy and creativity is a massive win. Now you're planning weekly walks with friends, building connections while staying active. Investing in your mental health, ensuring that your emotional well-being is prioritized is a huge win. And then finding providers who listen to you, who collaborate on a plan, and provide hope for improvement. This often involves an interdisciplinary approach, working together with your physical therapist, your primary care provider, and then potentially even a mental health specialist or nutritionist. So how can we help you at Aware? Our physical therapist will conduct a one-to-one virtual evaluation with you, get to know you, understand your pain, your injury history, and your symptoms. Together, we'll collaborate to set meaningful goals that focus on getting you back to what you love doing. We'll help to identify impairments. So like I said, we definitely want to look at your range of motion, your strength, your general mobility and posture. But we also want to look at factors like stress, sleep, and how they may be impacting your pain. And from there, we create a plan together that fits your goals and needs. So some final food for thought. Pain is not necessarily an indicator of tissue health. It does not necessarily equal tissue damage. There's not that 1-to-1 ratio between chronic pain and tissue health. Pain is a protector. Your body learns pain. We're bioplastic. And just as we learn pain, we can retrain our system to be less protective through bioplasticity. We can unlearn pain. You guys might have a lot of questions, so feel free to email us if you have any questions, but I just want to jump to the next slide so you have the information you need if you're interested in scheduling an evaluation. Just text that phone number or email the learn@awarehealth.io email with your email address, the company you work for, and we'll send you the personalized scheduling link. Like I said, we're a group of physical therapists. We could treat anything from headaches to ankle sprains, pelvic floor. We do health and wellness as well. So yeah, we're here for you. All right.
Thank you, Dr. Hall.
Yeah, I have 5 minutes to spare. So like I said, any questions, feel free to ask.
I have a question, Dr. Hall. Is chronic pain, is it defined if it kind of fluctuates throughout the day, or is that something different?
No, definitely. Yeah. So pain, whether you have it all the time or whether you have these flare-ups, whether it's day to day, week to week, month to month, if it's something that you're consistently experiencing, no matter what the frequency is, it's definitely considered a chronic issue.
Super, thank you.
Yeah. And if you don't want to ask questions out loud, you can always, like I said, email. You can email that email. We can forward them to one of the providers to answer.
I apologize if you said this already and I missed it. Yep. So will a recording of this be sent out of the session? This was awesome.
Okay. Jess, you can answer that.
Yeah, the recording we sent out. I'll send one out to everyone, and I'll also make sure you get one, Becky, and then everyone else at the. So it'll be sent out.
Awesome. Thank you.
Yeah, you're welcome.
Okay. Well, I think we're good. Like I said, I'm here if you have questions. I don't, if you're not aware of, if you don't know of Aware Health, it's a covered benefit under your benefits package, totally free for you. Follow-ups are all free. It's all virtual on Zoom. So yeah,
I have a question.
sure.
So I've had chronic pain for 9 years because of my Lyme's. I do see a specialist and I have a provider, but I'm having a hard time with our insurance to cover my name brand prescriptions.
Oh.
So how would you guys handle that if I were to make an appointment with you guys?
Yeah, we don't handle prescriptions. That's outside of our scope. That's a medical physician would have to do that. You know, Lyme's is one of those medical conditions, those underlying medical conditions that can be causing chronic pain. We could definitely work together, build some goals if you have any functional related goals. But with Lyme's, there's definitely a medical intervention like medication that you need should be taking. Yeah,
Well,
we
I
don't
do
have
take it.
Good.
I do take it, but with this insurance, I'm having a hard time
Yeah,
trying to
I-
get my name
I would reach out
prescriptions.
to your HR department, Gloria, definitely, and see if they can help you. It might just be the insurance that they provide, and there's nothing you can do, but maybe they can help you out.
Okay.
There's also
Sounds
cases
good.
where sometimes working with a physical therapist, we can communicate with your primary care or send over our notes or kind of a, recommendation on what we've been working on, and that can help give you something to present as well. I don't know if
Okay,
you've
thank
tried
you.
that. Yeah.
Okay. We all good?